Hi, welcome to CVC Interviews. My name is Joyce Vaudreuil, and tonight I'm here with some folks from Faithful Friends Therapy Dogs. Tonight we're going to meet some folks that work there, volunteer there, and some of their successful graduates. First, I'd like to introduce you to Alice. Alice, you're with Faithful Friends Therapy Dogs, and what exactly do they do there at Faithful Friends?
Faithful Friends Therapy Dogs is a new all-volunteer group that was formed to train handlers and dogs to work in the field of pet therapy. Therapy dogs work in nursing homes, hospitals, schools, libraries, anywhere an animal would help to calm a situation or to just provide comfort.
So before we meet the rest of the crew that are here tonight, I would like to know, what's the difference between a service dog and a therapy dog?
That's a good question. Service dogs are trained to perform specific tasks for people with disabilities. They work with their handlers. They do not work with other people. They don't provide pet therapy. Therapy dogs are trained to provide comfort. They work with their handlers as volunteers in social situations. So when you see a service animal, that dog is trained to either alert to a disability or perform a specific task, either mobility assistance, hearing assistance, seizure alert, diabetes alert. You're not supposed to approach or distract that animal. That animal needs to be focused on their handler.
Okay, and with the therapy dog, that's more of an invite for an interaction.
Exactly.
They're trained to be with people, to help people, not just their handler.
Exactly.
I see, okay. And we do have someone here with their handler. We have a therapy dog who's a pug, and you might hear his snoring, because I can certainly hear it. And your name is?
My name is Denise Bolduck, and I am the vice chair and the board of directors of Faithful Friends Therapy Dogs.
Okay, and you have a therapy dog here.
My dog Sailor is a therapy dog, and he's also a reading education assistance dog, also known as a read dog. And we go to schools and libraries as literacy mentors to children, because studies have shown that petting a dog while reading decreases stress, and children that might be nervous reading to a person or reading out loud will read to a dog and improve test skills, improve attendance at class, and has all sorts of benefits.
As a teacher, I can vouch for the fact that a classroom pet or a therapy dog definitely helps out students. They're non-judgmental.
Exactly.
They're just there for the loving. So
Exactly.
I definitely have some students with experiences with pets in the classroom, and it's along the same lines. And you are?
I'm Maggie Quinn. I am the co-secretary of Faithful Friends Therapy Dogs, and I do not have a service dog or a therapy dog of my own as of yet, but I am very passionate about therapy dog work, service dog work, and showing the difference between the two.
Yes, that sounds like it's the most common thing. Is even when I was telling people about the interview coming up, I had to educate them the difference, service dog and a therapy dog.
Well, I was in a hospital once, and I was walking with Faith to go visit Alice, and people were petting her and asking what times I would be here the next day. So it's definitely a very big misconception.
Okay, okay. And your name?
I'm Lynn Martin. I'm the treasurer of Faithful Friends Therapy Dogs. I don't have a therapy dog. I have a service dog, Frankie.
Oh, Frankie, yes.
But I've learned so much about the need for dogs and how much they can do for people just by going through the training with Frankie. And this is like just incredibly important to me to be able to offer up the education, the differences between the therapy and the service dogs. And as Maggie said, there's a lot of people that see Faith and Frankie and look at them and want to touch them and pet them and play with them. And, you know, it's a continuing education.
Yes.
You know, letting people understand they don't really have a place to play
Right.
per se when we're out and about. They have their break time at home. But, you know, in public, they're for us.
How long have you and Frankie been partners?
I picked up Frankie when he was 8 weeks old. I got him from a breeder in Rhode Island. And I got him specifically with the thought of having him trained to be a diabetic alert dog.
So I see some commonness with the breeds. Are there certain breeds that make better service dogs?
Well, in some cases, I think so. I mean, it depends on what the service is that it'll be performing. You know, Sailor would be perfectly capable of alerting me for
Sure.
diabetic alert, but he wouldn't be in a position to be, you know, a stability dog.
Oh, right. Oh, that's what you were alluding to,
Right.
depending on the disabilities.
It depends on the disabilities. Pretty much any dog can be a service dog depending on the disability. It would be difficult for Sailor to be a mobility assistance dog. Also, he could alert to somebody with diabetes, but going and retrieving her meter might be difficult for him because it would need to be someplace low where he could grab it quickly.
Oh, that's a good point.
And frankly, if he ran to go get help, it would be difficult for people to take him seriously. Because he's so cute, people would want to pet him and hug him. But to get somebody to follow him to her for help would be difficult. We tend to go with retrievers, mostly golden retrievers or Labrador retrievers tend to work best in those situations. Any working breed dog, shepherds in particularly, they have a need to work. So we use those dogs that want to be working all the time, that don't turn off easily.
Sure.
And in training a service dog, they need, believe it or not, doing nothing is a behavior. So we need to teach them to do nothing. So the act of doing nothing is a behavior that anytime we are still, they assume a down position and are quiet, but they're still ready to alert. If I were about to have a seizure, she would get up immediately and position herself or go to the closest person to get help, or go and retrieve my bag. So even though she's down, she could be up in seconds.
Very alert. So the two that are on the floor, those are service dogs.
Those are service dogs.
But more specifically, we wanted to talk more about the Faithful Friends Therapy,
Right.
which is more like what Sailor does.
What Sailor does.
And I understand it's a fairly new organization. You've branched off.
It's a brand new organization. I was the founder of an organization that was formerly known as Allen's Angels Therapy Dogs, that we founded in 2004. I have branched off from that group. Faithful Friends Therapy Dogs formed in August. So we are brand new. We're starting our first course October 1st, which
Excellent.
is this Sunday. And we will be training and getting therapy dogs out there. The training course is very intense. It's 3 months. We train the handlers how to work in specific situations that they could end up in, working with Alzheimer's patients, working with children, working with people that are recovering from physical disabilities, strokes, things like that, how to work in a hospital, how to work in a nursing home, all kinds of things you could encounter. The dogs, there are studies that show that dogs lower blood pressure. They help to distract people from their pain.
Sure.
So we want to get trained handlers and dogs out there working.
How do you get the dogs, how do you choose the dogs to be part of the therapy program?
We actually evaluate the person and the dog as a team because the person is just as much part of that visit.
That makes sense.
So we meet we set up an interview before we accept somebody into a course. We meet the person with the dog. We see how well they work together. We want dogs that have already been through basic obedience training so they understand and they know sit, down, stand, stay, heel, come, all of the basics. We want to see the handler and dog working as a team. We want a dog that's nosy, that wants to go and investigate people. We want a dog that loves children and loves people, is good with other animals.
Yeah.
So when we do that interview, we meet them in a location that is foreign to the dog. So we can see how they are in a situation that
Sure.
is not comfortable for them.
So right now, Faithful Friends Therapy Dogs has a Facebook page, so like us on Facebook, please.
Yes.
And the web page is coming up, and just like any not-for-profit,
Right.
it would be helpful if folks would help you guys out. They
Absolutely.
can contact you. All the contact information is on Faithful Friends Therapy Dogs on
Yes.
Facebook, and you'll get the web page up and running soon.
Yes.
Hopefully. Can you tell me a little bit about your therapy? When you were training your dog to be a therapy dog, did you know that this was going to be a good partnership?
Well, I got my pugs, Sailor, as a litter mate. It's also a therapy dog. They came home to me when they were 9 weeks old, and when they were 13 weeks old, they started doing some training with Alice and some of her colleagues. And Alice, I said I wanted to do therapy dog work, but it's okay when you have a puppy to want to do that. But if the puppy doesn't grow up and want to do that and
Right.
have the right personality, then that might not work. But Alice said to me in our training when Sailor was about 18 months that she would recommend him to try therapy dog training. She told me she couldn't guarantee that he was going to pass the test because he would be the youngest that ever did. But she saw, knowing him, we did a lot of obedience training, and not so much to be the perfect obedience dog, but I wanted to get him out and socialize, and I wanted him to do things. So Alice saw him a lot and saw his personality, and we gave it a shot. Sailor's sister took a year and a half to get to the same level because she was a little bit too exuberant. So, but she's a very good therapy dog now, and she's got her own special talents. She actually one time Alice was not feeling well, and Scarlett was alerting to Alice. So if that was something that I wanted to encourage in Scarlett to become a service dog, that's a talent that not all dogs have, so that has to be something that's noticed and then could be encouraged. Did not go that route with Scarlett, because then I would have to give her away to somebody who needed her. So, but Scarlett, when we both my dogs, we spend a lot of time reading. Scarlett can be high energy, but she seems to know when kids are high energy, and she'll do things like lean up against them or sit on their lap. I never make my dogs to sit on anyone's lap. If they want to sit on someone's lap, they can. They have, in my mind, they have their own free choice about that situation, as long as the person is agreeable to it. And children love to have the dog sit on their laps.
Yeah.
And I can remember a particular situation where the little boy in school was kind of like Dennis the Menace, or as my mother would say, he had ants in his pants.
Yes.
And he would come out and be all high energy, and Scarlett would be low energy with him. Lean into him, sit on his lap, and he would love that. And the only way she would do it is if he stayed nice and calm. So she knew what that child needed, whereas with other children, maybe she has a little bit more exuberance.
Wow.
It's true, petting a dog lowers your blood pressure. Your body secretes a hormone called oxytocin, but petting a dog also secretes the oxytocin in the dog. So petting a dog is good for the person, and it's also good for the dog.
Asila looks very happy right now. So do you have an office that you work in?
We are an all-volunteer group. We have monthly meetings. We rotate at different people's houses.
Oh.
So We don't have an office. We again are brand new, so we meet at each other's homes. We have our training classes at a place in Vernon called Dog Essentials, and we rent the training room there.
Very good. And you have monthly training sessions, or it depends on how many people are signing up?
When we teach a course, we meet once a week for 2 hours, and it's 12 weeks long.
Yeah, that is a long course.
So it's pretty intense. Like I said, we rent the training space at Dog Essentials for the course. But for our general organization, the board meets once a month to go over what's happening.
Right.
And we rotate between people's houses.
Well, that's a grassroots organization if I
It
ever heard of
is,
one.
it is.
That's wonderful. Then all of your energies go right into the animals. How do people usually find out about organizations like yourself? Is it word of mouth? Is it search engines? Like, what's the best way to get information out to folks who are thinking that they need a therapy dog or they want to be a therapy dog person?
Find us on Facebook. We are doing some events. We were at Tractor Supply in Vernon last week. We are doing this.
We have a bookstore visit coming
We
up
have
in
a bookstore visit
couple
coming
weeks.
up. So we do some fundraising events for ourselves. But the best way to find us right now is Facebook. And hopefully we'll get our website going in the next month or two.
Very good. Well, you did return my call quickly, so that's good to know. You want to make sure you can get in touch with you folks. So what's one of the biggest misconceptions about therapy dogs that you'd like to clear up?
Often I get phone calls saying, I want my dog to be a therapy dog because I want to be able to take him with me everywhere.
Oh,
And therapy dogs are not service dogs. They don't have public access rights. You can't take your therapy dog with you on a plane saying that it's your emotional support animal. They're very different. Therapy
that I
dogs.
didn't know. I did not know that you couldn't have equal access.
The wording is confusing. Just the word therapy. Sometimes I think people they contact us because they do want a service dog,
But they
ask for a
understand the
therapy
difference.
dog. Yes, they don't understand the difference. Or I get frequent phone calls because of my work in the READ community. I get
Sure.
I get lots of requests for I need a therapy dog for my son who's autistic. And so what they do need, there are service dogs that work with autistic children.
Right.
And they're right in the sense that a dog could help their son, but it's not a therapy dog that they're looking for.
And I'm a teaching assistant, and one of my students said that she wanted a therapy dog, but one of the most common misconceptions about therapy dogs is that they're not emotional support animals, and there's a big difference between those two. Service dogs are not therapy dogs. Therapy dogs aren't emotional support dogs. So I had to explain to her because she wanted one for her depression and anxiety, and that wouldn't be a therapy dog that goes around, and they do provide comfort, and I really enjoy Sailor being right here. But an emotional support dog is trained like a service dog to only work for one person, but they only provide comfort to that one person.
Whereas Sailor, a therapy dog, can provide comfort to anyone.
Exactly.
Okay. I was telling you guys, I worked at a mall where a nearby organization would bring the dogs in to socialize them. Do any of you have any experiences with going into like Buckland Hills or something with your dogs?
We do that when we're training service dogs.
Service dogs.
I have a separate organization that's Faithful Friends Service Dogs, and I train service dogs primarily for veterans with PTSD. But I also train medical alert dogs. And we do that when we're working on public access training with the dogs.
Okay.
We go to Buckland Hills
Yeah.
or any other, we go to Evergreen Walk. We go all over the place to socialize and train those dogs. But when we're training the therapy dogs only go places where dogs are allowed.
Okay. Do you have to make prior arrangements with? I would imagine in a hospital setting you would. What about something like a library? And is that something that you just say, oh, I'd like to start a read program, or do they have it already?
No, we usually will work with the librarian. I'll go to a librarian in town, and I have a little resume, and I have some literature about the benefits of reading education assistance dogs, which is actually an national and international program since 1999. So it's actually well known. And so I'll go and provide evidence of sailors, the kind of training that we have, and our proof of insurance, and explain what the program is. And more often than not, everyone's on board. So it's and then I'm a nurse, so I also have access to a hospital. And I worked very hard to get my dogs into the hospital that I work in. Now their therapy dogs are very popular there. So that there I'm part of volunteer services. So I had to go through some training there, and then we'll get an email if a patient in particular wants to see a therapy dog. We'll go out to the therapy dog handlers, and whoever can go in will go in. Otherwise, I go once or twice a month with my dogs and visit certain areas, and it's as much for the staff as everyone else. We're always invited for Nurses Week, and the nurses love the dogs. And it's even when we go to school, we stop in the office, and everybody has to come out and say hi to the dogs. And
It
and
happened
think
when you
about
walked
it,
in
5 or
tonight.
10 minutes, just interacting, and it just
Yeah.
kind of brightens your day.
He looks quite majestic for a pug. He looks quite comfortable and confident. So
good boy.
could you explain to me, Alice, what is this training? It's 12 weeks, 2 hours a night for 12 weeks. That's a lot of training. I got certification for a program under that amount of time. So what would the first couple of lessons look like, and how do you go from point A to point B to being a graduate?
The first couple of lessons, we do a lot of team building exercises because we want the handlers to work together, and we want a lot of camaraderie amongst the handlers. So we do some team building exercises. We also will do exercises with the dogs, exposing them to wheelchairs, walkers, crutches. We have a really interesting baby doll that is lifelike.
Scary.
I was thinking creepy.
Yes, yes. Well, I didn't want to use that word, but it's weighted, so it's like a real baby. It looks like a real baby. When you I don't put batteries in it. When you put batteries in it, if somebody touches it, it makes noise and its hands move. So we have that in something so that we can see how the dogs are around infants. We have a stuffed dog that we put in the middle of the room so that we can see how they interact with strange dogs. The exercises are to get the animals used to that equipment and used to working with their handler as a team. Then we move on to specific exercises to work with different situations. We teach them how to work with people on their fine motor skills. We teach them how to work with people in gross motor skills. If somebody is weak on the left, we specifically teach them to position the dog on the right so that they have to reach across and use their left hand. We educate our handlers about working with people with dementia and Alzheimer's and how to approach and what to expect in those visits. We do a lot of explaining to our handlers and teaching our handlers about you get attached to the people you work with, and it's difficult when you lose one of those people. So we teach a lot about self-care. We teach you how to be prepared in those situations and to try not to get too attached to your people that you're working with. We teach you how to work with children, specifically floor exercises if the child is on the floor working with the dog. We train the dogs how to tolerate rough handling, things children would do,
Oh,
pulling
yes.
ears, pulling tails. So there is a lot of intense training
Wow.
that goes into training the team, and that's what it is. It's teaching the handler and the dog to be partners, but it's also teaching the handlers to rely on each other.
Do most people who go to your program want to do it for themselves personally, or they want to be available to go out to schools and programs?
They want to be able to go out to schools and programs,
Okay.
hospitals, nursing homes,
Sure.
and that's our goal. We want people that want to volunteer and work in those social situations.
Wonderful.
And as I said, it's 100% volunteer. We rely totally on fundraising, and the cost that we charge for the course covers expenses only. So
Rental
nobody
of the
gets
space.
paid. Nobody gets paid. It's, again, everything is volunteer.
Wow. That sounds like a lot.
It is.
So do you stay in touch with a lot of these folks afterwards? Like, obviously,
That
you guys all stay
we
in
partner
touch.
we partner everybody with a mentor, and we reevaluate everybody on a yearly basis. We set everybody up with what we call a team leader, so that they are in constant contact. We know where everybody's going. Again, the exercises that we do in class are team building exercises. One of the exercises we do, we call it the cocktail party, where you have to tell you partner up and you tell everybody something about yourself and your name, and then we go through and have everybody repeat everybody's name and what was that one thing that they told you about themselves. So that, again, team building exercises amongst the handlers, as well as teaching partnership with their dog.
Right, right. So basically, you started this program so that you could help people get more therapy dogs, understand the difference between a service dog and a therapy dog.
Exactly.
And the way people can help, thank you all for coming here tonight, but the way people can help you folks out is to visit their Facebook page. Please like them on Facebook. It's Faithful Friends Therapy Dogs. And if you have any interest at all, please contact Alice or the rest of the crew. They'd love to help you out. Thank you. This has been Joyce Vaudreuil with CVC Interviews.
Thank you.
Watch this. Down. There you go.